Call 1-800-HURT-NOW and get the settlement you deserve.
Welcome back. We're focusing on your health questions today on Ask the Expert. We have Dr. Burton Brodsky here with us to answer some of your questions. Doctor, so good to see you. Thanks for being with us this afternoon.
Thanks for having me.
Well, the first question we have for you says that February is Heart Month. What impact does heart disease have on pregnancy?
Well, 1 to 4% of pregnant women are affected by cardiovascular disease, and that's the leading cause of death in women that are pregnant and in the postpartum period, and accounts for more than 25% of all maternal pregnancy deaths. And 1 out of 4 of these were preventable with early diagnosis and management.
Okay, good to know. And the next question we have for you, doctor, says what are the risk factors for cardiovascular disease in pregnancy?
Well, being African American gives you an increased risk of 3 to 4 times higher of dying from cardiovascular disease. Another one is age, older than 40, which is older. Certainly I'm almost 52 now, so that increases the risk of cardiovascular-related deaths 30 times compared to a 20-year-old. Also, increase in blood pressure, which is about 10% we see in all pregnancies, can lead to increase in morbidity, mortality, increased heart attacks, heart failure, a significant amount. And also obesity is a huge factor. It affects 30 to 50% of all Americans and really impacts all facets of one's health, especially cardiovascular disease. And just remember that obviously obesity is modifiable, as is hypertension.
All right, thanks for that, doctor. And the third question we have for you, what signs and symptoms of heart disease should I look for?
So symptoms are shortness of breath, chest pain, palpitations, fainting, fatigue. And some of the signs you'll see are increase in heart rate, blood pressure, increase in respiratory rate, and a decrease in oxygen saturation, which is really done by your practitioner. So if you're feeling any of these symptoms, it does not mean that you have heart disease. It just means you need to communicate these to your practitioner. The key to heart disease is seeing a practitioner early, ideally before pregnancy if possible, getting a clean bill of health, and working closely with your practitioner during pregnancy so you're proactive in managing your heart health. So you always want to be proactive and not reactive with heart disease.
All right, Dr. Brodsky, thank you so much. Good advice there.
Thank you.
And next time on Ask the Expert, we are taking your legal questions. Remember, you can always email us your questions. All you have to do is send them to news@13abc.com.